Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about Parkinson's disease, understanding pathogenesis, neuroplasticity, and future interventions. What is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder affecting movement. It is caused by the slow breakdown and death of neurons in the brain, specifically those that produce the neurotransmitter dopamine. The loss of dopamine leads to irregular brain activity, which causes the characteristic motor symptoms. The average age of onset is around 70, though it can occur earlier. Symptoms and diagnosis, motor symptoms. Symptoms often begin subtly, usually on one side of the body. They include tremor, rhythmic shaking, often in the hands, pill rolling, bradykinesia, slowed movement making daily tasks difficult, rigid muscles, stiffness and pain in the limbs, postural instability, poor balance, stooped posture, and a high risk of falls. Non-motor symptoms. These can include depression, anxiety, constipation, sleep problems, and cognitive changes. Diagnosis is based on a combination of medical history, neurological exam, and ruling out other conditions. The role of dopamine and brain circuitry. The core issue in Parkinson's disease is the loss of dopamine producing neurons. The basal ganglia, a group of brain structures, uses dopamine to control and automate movement. This loss disrupts the balance of the basal ganglia's direct and indirect pathways, leading to impaired motor control. Neuroplasticity, the brain's double-edged sword. Neuroplasticity is the brain's ability to reorganize and adapt. Physiological neuroplasticity allows the brain to compensate for the initial loss of dopamine neurons, delaying the onset of symptoms until up to 30 to 50% of these neurons are lost. Pathological neuroplasticity leads to maladaptive changes that can worsen the disease. A key example is levodopa-induced dyskinesia, where the brain becomes overly sensitive to medication. Early detection, a new frontier. Current diagnosis is often reactive, occurring after significant neuronal loss. Traditional early warning signals based on critical slowing down are often too late. A new theoretical framework proposes a more sensitive approach using non-equilibrium dynamics of neural circuits. The difference in cross correlations between forward and backward neural activity can serve as a much earlier indicator of disease onset, potentially before motor symptoms appear. Current and future treatments. Medications. Dopamine-based drugs like levodopa can help manage symptoms, but may lead to side effects like levodopa-induced dyskinesia. Deep brain stimulation, a surgical procedure that influences neuroplasticity and can reverse levodopa-induced dyskinesia, though its exact mechanisms are still being studied. Future directions. The new research points towards therapies that can precisely target and reset pathological neural connections. Combination therapies that modulate multiple neurotransmitter systems will be crucial. The promise of biomarkers. Identifying reliable biomarkers is crucial for early detection and personalized medicine. Potential biomarkers are being explored in biofluids, for instance, blood levels of brain-derived neurotropic factor, and through neuroimaging. The proposed early detection system requires high precision, time-accurate neural data, which could be collected using implantable microelectrode arrays in high-risk individuals. More research is needed to standardize and validate these biomarkers for clinical use. Conclusion. Parkinson's disease is a complex disorder where the brain's own adaptive processes can both help and harm. New theoretical frameworks are deepening our understanding of its pathogenesis. These models offer a concrete approach for earlier detection and the development of highly targeted precision interventions. The future of Parkinson's disease treatment lies in harnessing beneficial neuroplasticity, identifying robust biomarkers, and implementing personalized multi-target therapies. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this channel.